you that I am on a God assignment. Um, it's no joke. Almost 70 people applied for this position that I applied for. And I knew that God had created this position for me. When I read the job description, I boldly and unapologetically, with a lot of community support, including letters of support from Jane Williams and others that I've worked with in the community. I've been a community volunteer for years. I've started neighborhood associations right here in Central Columbia. Did a lot of public health work, keeping communities safe, creating safe environments while raising my children, even though I didn't realize that was public health work. So God had prepared me for such a time as this. He has really embedded me in the public health work of Boone County. And who would have known I would be sitting here in the middle of a pandemic for such a time as this? So I want to say thank you for the work you're doing in the community, the testimonies of people who have sat at your feet, precede you, and go before you. So your work is so valuable, not only to this community, but to the kingdom in restoring health to people that are living in poverty, and the way you lock arms with them and walk them through this valley. I applaud you, and God bless you. So Jane asked me to share my work, Live Well by Faith, and which was birthed out of our public health department. Looking at the data over the years, it was evident that the African Americans in this community were failing miserably and dying prematurely from preventive diseases. So they decided to write a grant to address it. And it was under the umbrella Live Well Boone County. They had some African Americans on the board or on the committee or on the focus group that were not from Columbia. They were from cities like Kansas City, Missouri. Reverend Carmen Williams, who was the former pastor of Russell Chapel CME Church on Ash Street. She was my friend and partner. And when she came to Columbia to pastor that church, I got her involved and connected with the community. And she really got involved with public health. And it was through her input that the City of Columbia's health department wrote a grant to address the health disparities of right here in Boone County. And I'm going to sneeze in a second. Whew, bless me. That was a good one. It was amazing. They wrote this grant addressing health disparities, specifically hypertension and diabetes, because our report card right here in Columbia, let's not even talk about national, but right here in Columbia, Black folks are dying at a rate of like 4 to 1 from hypertension and diabetes. That is criminal. So they gave me they didn't even really give me a framework. They gave me the outcomes expected from implementing preventive health programs in the Black community. And the way they wanted to do that was to go through the Black churches, setting up health ministries, which makes sense because historically, any movements that gained traction and were successful were birthed in the Black church, because there was nowhere else for Black people to go. They weren't welcome anywhere else. So they created, when they were freed from slavery, one of the first things they did was establish their churches and places to educate their children, our children. So it just makes sense to go to the Black church. But then, as I'm studying more and more about public health and that target population, there's a huge lack of trust of public health entities in that population, target population, and there's good reason. There's a history of abuse through public health, that world, when it comes to African Americans. So they really needed someone that was entrenched in the Black community, especially specifically the faith community. Well, I'm a church girl. I grew up in church, and I've been very active in the Black church community here in Columbia. And so I was very well connected to the faith community here, as well as the leadership here, the pastors, just from community involvement and going to programs, having friends at various churches and supporting their programs, showing up. My kids grew up in the Black church here. So they know my family. So the trust issue was already there. That foundation was already laid. So I got the job, which was so exciting. And I sat down with the data. Now, mind you, I have no background in interpreting data, no background in the scientific language that is being used. I had to, Google became my friend, and is still kind of my friend. When I say I have no background in public health, one of my medical directors told me, Verna, stop saying that. You've been doing this work almost 5 years. You can't use that anymore. So I looked at the data that they handed me. It was like the report card, the health report card of Boone County. And when I got the job, and I sat down with it and looked at the infographics that the county's epidemiologist at that time, Sarah Rainey, created. And my heart sank at the disparity rates. I mean, she drew a picture, and I sat there at my desk, and it was like somebody punched me so hard in the gut. I just sat there and wept on my first day on the job. I felt like God was calling me to an assignment that was so much bigger than me. And I get a little emotional even talking about it, because it's just amazing when God has an assignment for you to fulfill. And this is really the way I tell my story, okay? I will talk to the mayor like this. I have one face that I present to the city, and I am a woman of faith. So whatever work I do, my relationships with people, you're going to experience my language, my faith walk, all of that. It's just who I am. It's in my DNA. And I look like my father. I talk like my father. I use his words. And so I praise the Lord at my desk at work. I'm talking to pastors all over this community. So I would like to think that I bring a lot of light to the health department with my presence and my God assignment. So I'm looking at the data, I'm talking to God, I'm overwhelmed. I don't know where to begin. My supervisor at that time was less than 30 years old. Okay, you guys? Ladies and gentlemen, my supervisor was like 26 years old. Okay. And she had an MPH. So, and she had the back corner office. So okay, you're the queen, you're the winner, you're smarter than me. I'm here to learn. But she knew nothing about community work. And that's where I was the expert. Okay. I had relationships that she would never have. So she just told me what the expectations were, and no one told me where to go, how to build it. So I sat there with the infographics and the data and a broken heart, had just been punched in the gut. And I'm asking God, where do I go from here? There's nobody here to tell me what to do or how to do it. So we have won every award imaginable at the national level, state level, and the local level. And just this year, while on COVID duty, the Missouri legislative women gave me the Laverne Calloway 2020 award, whoever she was. I think she was the first Black female legislator in Missouri. So she was somebody, a trailblazer. So I say all this to say that God has an assignment for all of us, and no one else can fulfill it but us. And who he calls, he qualifies. So what I did was I began to set up meetings with the pastors, one pastor at a time. And I went in, I explained what the data was, and I asked them if they had a health ministry. And if they did, was it active? The only health ministry in a Black church in Columbia, Missouri that was active was Pastor Clyde Ruffin at Second Baptist, the largest Black church in Columbia. They had a very active health ministry. So I started with them. Their nurse, they have lots of nurses at their church. So they have a very active health ministry. They have monthly newsletters. They have events where they educate people with lots of unhealthy food choices. I'm just going to say that. I don't like events because there's no transformative behaviors that result from a health fair or a health talk and luncheon with a health focus. Nothing happens. You get a bag full of freebies and handouts and it's over. You go home, you let the kids take the toys out of the bag from the conference and nothing. No one's changed their diet. No one's doing more exercise. No one's monitoring their blood pressures. So I'm not a fan of events. So what I did was figured out that I would set up try to help the pastors who wanted to participate, set up health ministries in their churches and ask them to provide the leadership to run their health ministries. I would then take the leadership that they provided us and call them lifestyle coaches and provide them monthly training opportunities at the health department. Pre-COVID, they were once a month trainings with dinner, with a healthy dinner being catered, and they would receive training, certification, information from different departments or initiatives that we were leading here at the health department because I'm connected to all the experts. I didn't need to have all the information. I just called the experts in to give us that information. case in point, my lifestyle coaches learned the disparity rates in the HIV population here, and how people are suffering in silence because they're afraid of judgment from the church folks. So really getting them to open up and allow that education in their faith communities, and not live like it doesn't exist, like everyone in the congregation is chaste and exercising abstinence, blah, 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 blah. So where they haven't welcomed public health information, we're now getting traction, and they're allowing public health information in their faith communities. I love Live Well by Faith. I love the lifestyle coaches. Pastoral leadership changes a lot in denominations. I don't know if that's the way it is everywhere, in all denominations. They have these big conferences, and then they come home with a new assignment, a new pastor. So I feel like with Live Well by Faith, I'm starting over all the time with educating new leadership. But I have to tell you that in the database, because I've been collecting data since we started late fall 2016, everyone that has participated in our evidence-based programs, and let me I'm gonna go back to evidence-based programs. Remind me, Conrad, if I don't get back there, because that's real important. But everyone that has participated in a Live Well by Faith evidence-based program, be it Weight Watchers, the weight loss competition, the Walk with Ease program, the African Heritage cooking class, the chronic disease self-management course, which I renamed Fit, Focused, and something, Faithful. Sometimes you have to rename programs, because Christians, if it doesn't have a sexy name, they ain't showing up. Yeah, these church folk. I had to who wants to attend a chronic disease self-management program? I don't have a chronic disease that needs to be managed by myself. No, that's for the really sick people. So they didn't understand that if they were taking medication every single day of their lives, that they had a chronic disease that needed managing. So, I mean, vocabulary was very important. Language is very important. We're using big words like comorbidities, social determinants of health, chronic disease. That is a language that none of them could relate to. So I had to, there's a lot of educating going on, explaining, yes, that's you, honey. It's got your name all over it. You need to show up. So changing the names of evidence-based programs so that they would want, and then representation is everything. I had to look for pictures that looked like the target population I was trying to reach, because public health in the Black church is a new thing. And health programs in the Black church, I mean, not events, programs, at minimum 6 weeks long, and sometimes more than once a week commitment. That's transforming lives, because case in point, we're right now ending a Walk with Ease program. We have probably about 60 or more participants. I'm collaborating with, in this pandemic, we've just begun to do more collaborating, organizations have. I'm collaborating with Catholic Charities of Central Missouri and Lincoln University and University Extension, Cole, Callaway, Cooper, and Boone counties. So Live Well by Faith already has a reputation in the community, especially with the Black population. Though we don't, our programming is free. We don't, even though our target population are those dealing with health disparities, and that's the Black population here, we don't exclude anyone. So if there's anyone in need of our services, our health education, that's a benefit of being a Boone County resident. So as long as they're able to participate and have no problems participating with our Black church leadership, everyone's welcome. So, and
Verna, is your program just City of Columbia, or is
county?
It's county.
But in our collaborations, which I just mentioned, the walking program, we have people from Harrisburg, Hartsburg, Jeff City, Boonville, Centralia, Fulton, because we've all collaborated together. We put together the program, and then everyone takes the information and shares it with their listserv, with their community. So we're getting participation from all over mid-Missouri now. But what I do is those that I recognize as Live Well by Faith participants, or who align themselves with Live Well by Faith, they get extra perks. I do the best I can to incentivize. Yes, I do, because I want results. So everyone that participates in a Live Well by Faith program at minimum commits to 6 weeks, sometimes 8 weeks. And there's pre and post tests involved. So when they register for a program, we give them a pre-test. So there's data collection. Now, the challenge with me in doing that is I'm asking for data. I'm asking questions that other organizations don't need to ask, but my funders need to, they need evidence that what I'm doing is working and making a difference. So they'll continue to fund us. So that's been a challenge for me, because University Extension doesn't agree with me asking their population or their community the questions that I've been asking all along. So what we've come down to, I have to really go to the courts of heaven sometimes to get answers that I need to operate this program strategically in our community. And so because I do have access to incentives, and I can incentivize the population that participate. So what I'm asking them now, those that want to participate in the pre and post tests, get a Walmart gift card. So our data is amazing. I have an intern right now reviewing our data all the data and the outcomes in our database. And I'm telling you, almost every single person, and there's like 296 different participants that have participated in Live Well by Faith programming. And I would say 90% have reduced BMI from pre-test to post-test. Ladies and gentlemen, that's just amazing, is what it is. And that's why we have been successful in winning all these awards. Now, my question to the governor, my question to the State Department of Health and Human Services is, why aren't you duplicating this work statewide? Why aren't you accessing churches, which is an untapped resource in our communities, in vulnerable populations in the Boot Hill? Okay, you all, it's looking really bad outside. I'm sitting in front of the window. Can you see it?
Yeah, I just had to close my windows. We have a heavy downpour here.
Might have to, Mom. We'll wait a few minutes. My mom's saying, "Oh Lord, we may have to cancel."
Yeah, I can't. The color of the sky here is really weird, Verna. We're seeing that.
Hold on. Can you hold on a second? My mom's yelling about something. Hold on.
Sure, no problem.
Yeah, our sky looks just a real funny color right now.
It's just gray over here off of Route K, but
yeah, it's getting kind of a greenish gray cast here, Debbie. I'm on the east side of town.
Mm.
Okay.
It's storming really bad up here.
We shut doors. Stuff's blowing outside. Okay, we have more time. She's going to cancel her appointment.
Verna, what part of town do you live in?
I'm on Worley Street, next
Okay.
to Calvary Baptist, which is now Caris, and
Yeah.
that big white Victorian on the corner of Worley and Ridgeway. So
okay.
I am right down the street from my office. And I get to stay home and work from home and take care of my 80-year-old mother, who isn't in the best of health. So Mom's lived with us for 8 years, and I take care of all her goings and comings. So, and her appointments and all her needs. I'm her 24/7 caregiver. 365 days a week.
Yeah. And you won't regret it.
That's
You'll never regret that.
Another one of my assignments, yes, on my life. And I took care of my grandparents. So I took care of my maternal grandparents when, gosh, it was probably like 1977, 78. I came to Missouri, Hannibal, Missouri, to care for my grandparents who had serious health issues. And my grandmother was in the hospital with breast cancer, and it wasn't looking good. So I'm like the family caretaker. Everyone knows Verna will take them in. So
you had a health background of a sort anyway.
You know, I never thought about it like that, Debbie, but you're exactly right. I was created this way. And I don't think it's anything that you can really teach people. It's just they were created to do this. And I think that's why I've experienced so much success with Live Well by Faith, because that's what I do anyway. I remember sitting on the edge of my bed. I worked in insurance for 14 years, and that's a story. The things I suffered through, but God never released me, and I had to sit until He released me. And I'm telling you, when he released me into public health, I thank him every day that I'm here in the position, getting paid to do what I love. This isn't work for me. Helping people get on track with a healthy lifestyle. I told the Lord, I was just in my quiet time talking to him about, after reading the data and understanding that there was really no one to help me but him to do what has never been done with this population here. I said, okay, you've basically called me to a sea of dead, dry bones. There's not even flesh on these bones, but you want me to raise the dead and cause them to thrive and dance. And all you've given me is a stick. And it was like, now this is how God talks to me. He speaks my language. He said, girl, show me what you're working with. A stick is all you need. So I'm telling you, I am a hope dispenser. And with this team of lifestyle coaches that we have that are leading health ministries all over Boone County in Black churches, and we even have, I'm talking to my heads up, my department heads, that I think we need to expand to all churches because we have pockets of African Americans in all churches. They're not just in Black churches anymore. They're out at Woodcrest. They're downtown at the Methodist Church. They're everywhere. They're at Caris. They're at Destiny Point. And I think conversations need to be had with the faith community all over, especially in light of COVID, that we have vulnerable populations in our faith communities that we're working hard to protect. I don't play with it, and I'm not going to allow my faith to cause me to act stupid and careless, okay? And so I do wear a mask when I go into spaces where I can't physically distance. I don't like using the term social distancing. I am socially connected, though I physically distance.
I like that too.
I like that better. We're going into a dark time. We're walking into a dark time right now where it gets dark earlier. It's cold, so we can't sit out on the porch. Yesterday, I had my last of community meetings in my yard because the temperature is shifting to fall, winter. So people are sitting in their homes, isolated and alone, and we're coming into the holidays and no one gets to do it like they used to do it. If they do, they're taking a big risk. Because I was one of the contact tracers early on when we had to cease the in-person meetings, and all of my programs were in person, just like everyone else. And we had to cease. So I'm trying to figure out, and it was in the early stages of COVID when we really didn't know a lot. Now we know that African Americans with comorbidities are very vulnerable to this virus. And I know enough now because I've had so many family members test positive. Some have been hospitalized. All have said they never want to be that sick again. So there's no family gatherings here at my house. And if I let you in, if I let you in, you will have a mask on. I have my 80-year-old mother here with a heart defibrillator and all kinds of health issues. I'm just not going to be careless with her. And I usually take her everywhere she needs to go. So I'm going to take a pause and see if there's any questions.
Well, your program is targeted specifically to African Americans in Boone County.
Target, but is not exclusive to just African Americans. See, I have funds I can share. I have perks I can share. You know, my folks get a lot of gift cards. And I just enjoy being a blessing, because that's definitely my love language, gift giving. So no one gets more pleasure out of giving those Walmart gift cards away than I do. So I make sure I keep a stash. Even the monthly meetings, the monthly trainings with the lifestyle coaches, because they're volunteers, they get a $25 Walmart gift card.
Do a lot of your former participants become the coaches, Verna? Or do some of them?
Yes, absolutely. That has happened. Let me tell you what's so wonderful. I was able to get every single Live Well by Faith lifestyle coaches trained and certified in CPR and ADE, using the ADEs. And do you know, when I did that, was preparing that training, I did not know there was not one Black church in Boone County that had ADE equipment. Not one. The most vulnerable populations in the city did not have access to that life-saving equipment in their facilities. So we were able to secure 6 ADEs, and they run about $1,500 to $1,700 each. We were able to secure 6 of those and release them into 6 of the Live Well by Faith churches. Now, my goal is to write a grant to Firehouse Subs. They have a grant program for like EMTs, fire stations, and other nonprofit organizations. And I was told by the person who came from Zoll, ZOLL, that's where we bought the ADEs from, that Firehouse Subs gives away lots of money for life-saving equipment. So my goal is to, and they do it like 3 or 4 times a year. So I am going to be working with an intern, hopefully by the next granting season, to be ready to submit an application for about 12 AEDs to have them placed all over in the population, in the faith communities, to make sure all the churches have those installed with people in their facilities that know how to use them. So, yes, Debbie, the target is African Americans, but anybody who needs support can participate free. The only place where we're charging for programming is WW, formerly known as Weight Watchers. We even pay half of the fees associated with being a part of WW.
Do you do much with maternal care? I know maternal health is a big issue in the community.
I don't with Live Well by Faith, because our focus is hypertension and diabetes, though I am in talks with my superiors that I believe trauma healing is where we need to expand. There's a lot of folks out here walking around with trauma and no place where they're counseling or dealing with it. So when a person's soul is in trauma, how can they effectively grow in the things of the Lord when they're so busy nursing their wounds? You can't. And we wonder why poverty is such a big issue with that population. I mean, we are so busy nursing our wounds, it's hard to grow past it. And then it's compounded. And I just want to do something to address it. So I'm talking to them, you know, there's a lot of things I want to do and I can't do because the grant doesn't cover it. It doesn't allow me to stretch and grow. A part of me thinks, maybe we've outgrown the health department and we need to get a grant writer and expand to maybe be a part of Love Inc. I don't know. I'm dreaming.
Yeah. Yeah. Sounds like a good dream.
I'm dreaming.
That Boone County Children's Services Fund would be a good place to look, I'd imagine, right?
Uh-huh. Uh-huh. So, and at the same time, I don't want to be restricted to just the Boone County Commission. Now, the Boone County Commission Children's Services Fund funds us. But what if something happens to that pocket of money? Do you know how many organizations, children, and families would be hurt and devastated? So I'm like, God, show me where else to look, where else to go, to continue this work, to expand this work, to grow this movement. I have been on, I'm developing right now a relationship with the medical school. You would think that being a part of public health and right here at the University of Missouri Healthcare Systems, that we would be able to easily collaborate and work together. Well, not so. It's not easy. So I've been asking God for how to bring the town and the gown together in the health arena. I mean, we have MedZoo, we have some great things going on, but if we want to really expand the work and we want doctors and nurses to become culturally competent, especially with the people that they're serving, they need opportunities in those arenas. So what about community health? So I'm in talks now with the med school, and I have a program that they're going to be able to launch next semester, the residents, and they don't have lots of hours to do this service learning. They have like 18 hours, and that includes any training time. So I'm thinking, okay, God, what kind of program and experiences, really meaningful experiences, can I give the residents with this population? And so I've been in talks or a part of seminars on Zoom with, they're called, I forget the name, they're out of Michigan, but they're launching a federal program that is teaching people how to monitor their own blood pressures. It's a self-monitoring blood pressure program. And I did a case presentation the third week. It was a 6-week online program with people all over the country. And when I was allowed to introduce myself the first class, I was the last one that got to do my introduction. And I said, okay, they just gave me the mic. So When they gave me the mic, I not only introduced myself, I gave them a brief synopsis of Live Well by Faith and all the awards that we were winning here in Columbia, Missouri, and how the state of Missouri wasn't backing us up. That was the first day. Okay. The next week I listened and I wanted this program for us here at Live Well by Faith at our health department, but it was set up to partner with clinics so that you would teach people how to monitor their blood pressures. You would turn in the readings to their primary care physician, who would then adjust their medications or dosage or what have you. And I figured that was something we could do because all of our programs, we follow blood pressures. Everyone that checks into a Live Well by Faith program checks in with the interns, gets their blood pressures taken. If the blood pressure readings aren't good, we have a come to Jesus meeting about what's going on with you. What are you eating? Are you exercising? When is the last time you've taken your medication? Are you taking it at the same time every day? And then, I mean, they don't like to get the speech. They really don't like to sit in the chair and learn the truth about what their actual blood pressure readings are. They would argue with my interns. They would argue with the equipment. They did not want to face the reality or the truth of their conditions. They would rather be in denial, because that's why they call it the silent killer. They feel fine. Well, when you're not used to feeling good, of course you feel fine. That's how you feel every day. You don't know what feeling good is. So it's a wonderful opportunity. I love the work. In light of COVID, this population is really understanding how serious it is to protect themselves. So I don't know. Do you have any other questions?
Well, I wanted to ask you back to your thoughts on trauma. Have you read the book called The Deepest Well?
No.
Or are you familiar with it? It's by Nadine Burke Harris, who's
Spell that. What was her last name?
Well, her first name is Nadine, and then it's Burke, B-U-R-K-E, and her last, and then Harris, which you know how to spell.
I just put a link in the chat for you to, anybody wants to look at it.
Okay.
And she is a medical doctor who realized the effects of trauma on health, and it was a very interesting book, and talks about the adverse childhood experiences, the ACE scores, if you've heard of that.
Right.
So it's a book that might be good to read as a, in terms of health and trauma.
Yes.
I found it very interesting.
I pulled that up. Thank you. I will definitely check that out. So how many coaches do you have at Love Inc.?
That's a great question, because right now, since we're doing so much remotely, I think we've had around 50 extra mile coaches, which is a long-term 16-week program over the past few months. We just did an audit of our volunteers. And then we have about 15 in our short-term coaching, because it's just been very difficult to try to engage volunteers that way. So we just have a handful, in that arena. And I'd say actively right now, we're probably below 20, I would say, with active coaches, just because of trying to do remote coaching and crisis. A lot of our short-term coaching is crisis oriented right now. So we're handling a lot of that with staff, and we're not able to utilize our volunteers as well as we'd like to, unfortunately.
Is that including extra mile, Conrad? Does that include the extra mile coaching?
Yeah, so extra mile, the last real numbers that I have from Kelly are that we had about 55, I think, extra mile coaches. since February, but I don't know how many are currently active. That's where I'm guessing like we might have 20 that are actually meeting with people regularly right now.
So do all of the crisis people that come through for assistance and receive it, are they referred to Extra Mile coaching program?
It depends on the situation. If they're financially stable, then, or they can become financially stable, then yes. But by and large, when I say crisis, what I mean is that they're homeless, they don't have an income. And so we're trying to navigate what the resources are available to them to, help them get into a place and help them find stable income. So once they get past that, then yes. We also have some that we've had several teachers that we've talked to recently that I'd say in normal circumstances would be fairly stable and would qualify for Extra Mile, but because their kids are at home and they're not able to, earn an income right now, they wouldn't qualify, because you do have to have an income to be an Extra Mile. That's one of the
Right. You got to have something to manage.
Right, exactly. Can't manage money that's not there.
Right. Got it.
I'm kind of thinking about our life skills coaching program and how that could I don't know how Live Well by Faith and Loving have partnered in the past, but it seems like, oh,
okay.
Like there might be a fit that I know one of my Extra Mile clients would have really benefited from this at one point. And but I think that some of the I don't know how many of the life coaching clients we have at this point.
Well, we haven't developed life coaching. Honestly, it's much better in person than it is over the phone.
Yeah.
So we haven't been able to really take that very far, and I just took this position in February, part-time, and full-time in March, and then the pandemic hit. So we haven't really developed our side-by-side life coaching very well, so far, but that's definitely something that we could talk about. I'd love to work on that.
Absolutely. I'd like to figure out a way to maybe see how we could connect maybe some of your coaches with our lifestyle coaches, and maybe even develop more coaches from that population.
Okay.
Mm-hmm.
That's one elephant that's been in the room and this is probably outside the scope of this conversation, but we don't have a lot of peer support coaches. We very much have, just like the population you're seeing here, a lot of our volunteers are white, and a lot of our clients, more than 50% of our clients are African American, and we don't have a whole lot of, we can't bridge that gap very well. And so I would love to see
why it's so difficult, Conrad.
I would love to talk with you more about that. Yeah. Why is it?
It's difficult because we don't see ourselves as valuable, and who has time to volunteer when we're trying to keep a roof over our heads?
Yeah.
I was just blessed that I came to Columbia as a single mom going through a divorce with 4 broken children. And I was a Division of Family Services caseworker. And I need to wrap this up, but I'm full of stories. And my life is an open book. And I lived out south of town, and my kids walked to Rockridge Elementary. And Hap Hairston was the principal when my kids were at Rockridge Elementary. And I forget the assistant principal's name, but she eventually became principal at Midway Elementary, and I can't think of her name. But she came after me and recruited me to join PTA. And at that time, Nancy, I forgot her name, Debbie. She was from the.
No, I can't think of any of those names either.
But she was from the Walton family. And
Nancy Laurie.
Yeah, Nancy Laurie was there at the first PTA meeting. And it was like no one knew me. I was the only Black woman in the room. and no one went out of their way to welcome me. But I kept showing up to the meetings, and it's my story, my experience. And the first year, I might have volunteered to do chicken barbecue. That's a big thing at Rockbridge Elementary. That's a major fundraiser for the PTA there. And it's a lot of fun. And the families have been doing it for years, and they come back. And I mean, the community support for that is amazing. And then the next year, you know, I'm growing as a person. I'm still new to the community. And my children loved Rockbridge Elementary. The teachers were amazing. And so as a DFS caseworker, I went back. And at the first meeting, I raised my hand to volunteer. I was like, these white folks gonna work with me if they want this to be successful. And so what were they gonna do? Ignore, my hand went up first to lead the picture day. To lead picture day. And that is how, and I think the Holy Spirit lifted my hand up, because it's like, girl, these people need to know who you are, and you need to meet them and work with them. So I put myself in a position where people were kind of forced to work with me and get to know me. So I've been a diehard PTA mom, Girl Scout leader mom. I've raised 3 gorgeous daughters and 2 sons, and they married smart women. And so it's been great. And I volunteered because I'm going to tell you honestly, and then I'm going to be done, why I was such a diehard volunteer in this community. I think I had something to prove to myself more than anything, that I was valuable, smart, and had a lot to offer. And there were entities that wouldn't hire me for whatever reason. I was never qualified enough. But it's amazing, once I got my college degree, which I finished while raising my children, I applied for a position at the insurance company I left prior to coming to public health. And the first thing the corporate lawyer asked me at the company was, did I have a college degree and did I have a resume? I said, yes, I have both, and you'll have evidence in 60 seconds. You know, I read Zig Ziglar. I've read all the books. It's better to be prepared for an opportunity and not have one than to have an opportunity and not be prepared. So I got an upgraded position, which really was a political appointment early on in 2002, because I ran as a Republican candidate for state representative. And that's a book that's yet to be written, and a story that I'm going to tell one day. And because I lost my black card, Black folks spit at me. And for taking a stand for pro-life, for taking a stand for doing life the way I wanted to do it, for not following the crowd, and being obedient to the call that God had placed on my life. So I lost a lot of friends. Okay, they weren't friends. But I gained a lot, but that's another chapter, and that's not what you called me here to do. But I learned to be independent. I learned to do things afraid, and I gave myself away, because then they couldn't fire me. And they learned to work with people that looked like me. So God has called me to be a forerunner. My confidence is in Him. And He has strategically placed me in the midst of a pandemic with really no public health education, I'll say. I'm learning to fly at the same time I'm building the plane. and doing it successfully, by the way. Our outcomes and our data is just amazing. And right now I have an intern taking our Live Well by Faith outcomes data and comparing it to the county state data to really show how effective our evidence-based programs are in this targeted community, thus building a stronger case, I hope, with the state legislature when they're allocating funds to make sure they remember Columbia, Boone County, because St. Louis and Kansas City gets all the resources. They fly through I-70 right through Columbia and don't drop off anything. So on national programs, I call out the state of Missouri when I'm on the call. And so as a result, they're now calling me, setting up meetings because I keep calling them out and embarrassing them.
Good.
I just tell the truth. They're not doing anything. So, you know, public health has come out nationally and stated that racism is a public health crisis.
Yes.
I can tell you that it's very, very serious, and we must deal with this issue, especially in this pandemic environment, because the losses are great. But I will say we have a dynamic executive director at Public Health. She listens to what we have to say. They have operation meetings every morning to look at the counts and the numbers. Our numbers are spiking so high right now that they're calling back people like me to come back and do contact tracing. They have not called me. I'm hoping they've lost my number. Because I'm busy developing our lifestyle coaches and our Live Well by Faith community to be comfortable with using this platform, this technology called Zoom. So I'm teaching my lifestyle coaches one by one how to operate Zoom calls when it's really difficult because they don't have the language, you know, Control Alt Delete, you know, what's that? You know, just basic computer skills, or to use the mobile app. So I'm doing a lot of intensive one-on-one education to get them comfortable with even engaging in this platform.
That's something I was going to ask, is how can our coaches become connected with you to maybe connect with a Live Well by Faith coach? Is there a good way to
why don't
bridge?
we do this? Is there somebody, or would you be willing, Julie? I have monthly Live Well by Faith training meetings on Zoom.
Okay.
I think I have one this Thursday. I already have a guest speaker. Let me look at my calendar. Let me see, November's meeting is, okay, the 19th. Next Thursday is our training meeting. It starts at 6 and usually goes to about 8. And I have a special guest speaker Thursday from FACE, Family Access Center for Excellence, to talk about the free mental health services that are available in our community. So there's no reason, and then we'll probably be talking about, our focus is going to be safe ways to celebrate the holidays as we're going into this dark period, this isolating period, and yet we're trying to figure out how we're going to safely do Thanksgiving and other traditional holiday gatherings without gathering. Or if you do, how can you do it safely. So I haven't figured that out for my family yet, because my mom's already made the cornbread dressing. It's in gallon-sized baggies in the freezer. There's about 4 of them. She's talking about making banana pudding, caramel cake. Who is she doing all this cooking for? All those people aren't coming to my house unless they are doing front porch pickup.
That's what I was thinking. You could just have front porch pickup for any family in town.
You know, we'll sit in the door or something behind the storm door, and they can say hi to Granny, or, you know, FaceTime, do a Zoom call, but you can't touch her. You can't hug and sit in her lap and lay in the bed with her, or play games around the dining room table like we used to. I don't know how we're going to do it. I haven't broke that news to her yet. We're not doing it, Mom. So, how are you all doing it?
We have not made any decisions, Verna. It's been awful. I mean, nobody wants to decide anything because the
Same
numbers
here.
just keep. Go ahead. I take it over here.
The numbers are going up, and they are talking about how they're going to continue to spike as we go into the holiday season. I want to arrive alive on the other side of COVID. I want to arrive healthy and intact, and I'm doing everything I can to keep my mom healthy. So.
Well, Steve Hollis was saying on Monday, I guess the hospitals in Columbia are getting filled up with people outside of Columbia too. So we're not even going to have room for Boone County. It's
we're not going to have room for Boone County residents, because the smaller communities, not only do they just don't have the facilities to take care of COVID patients. We do. And they're not masking. They're not physically distancing. They're breaking all the rules that we've set, the parameters. They're not abiding by them. Now we're seeing spikes in those communities that continue to ignore the health orders. And so now we're dealing with the consequences.
Yeah.
But I would like to, if there's someone, Julie, if you would like to talk about the Extra Mile program or any of the other programs and resources that Loving offers, I would enjoy giving you the opportunity to explain that. And if you want to, on the 19th, I could give you a window of time to speak to the lifestyle coaches if you're interested.
Conrad's the coaching coordinator, but I'd be happy, Conrad, if you wanted to do that and me do it together, I'd be happy to come in, you know, as a long-term coach.
Well, and Kelly Van Doren may be good because she's the one that coordinates the Extra Mile program. So she could talk about that program and how those coaches could either get engaged potentially as coaches. I don't know. We haven't really talked about what an overlap or collaboration could look like, or even just how people could get involved with budget coaching through Live Well by Faith if they were to partner with us then for budget.
Yes, I like that. Let's work on that.
Yeah.
I'll get you, me, Julie, and Kelly in an email thread here, and we can figure out where to go.
Okay. If we don't, or if we're not able to do a 30-minute presentation next week, if we're not able to you could do that real easy. I would like to encourage you to do it, especially going into the holiday season before we, get into next year. I would like to at least plant the seed with this population and further, because even if they themselves couldn't do it or felt they themselves didn't have the capacity, there might be someone else in their faith community, in their church, that might be a good match. And what you could do is send me materials in advance that I could send to them for review. If there's any materials or anything you would want them to look at, any sample materials, we could use this as a recruiting opportunity to get more volunteers involved. You know, there are many retirees in my lifestyle coach group.
Okay.
So I would like to present maybe regular updates, and, you know, with this population, we can talk about that, you know, maybe have a Love Inc. moment or something during the training opportunities, the monthly training opportunities. So they become, and they could even serve as advocates for Love Inc. with their faith communities. I would like to see more Black church involvement with Love Inc.
Yeah, definitely.
I don't want just referrals. That's not involvement.
Right. Yeah. Yeah,
Don't
absolutely.
let me get started.
Yeah, no, I completely agree with that. Yeah.
Not just referrals, sending folks that you can't help or don't want to help, send them to Love Inc. No. Okay, anyway, that's okay. I won't get started. But okay, thank you for the opportunity.
Nice to see
Thanks for sharing,
everyone.
Verna.
Thank
Yes,
you,
and
Verna.
thank you. I'm gonna check that book out, The Deepest Well.
Yeah,
I might-
Lindsay recommended it to me because in her medical clinic, they're trying to think in these kinds of terms in regards to their clients' population.
Awesome.
So
Awesome.
Thank
Okay.
you. Thanks for what you're doing, Verna. Think of the lives you might have saved by doing this program.
Oh, there are many. I have testimonials. So yes.
Great.
Yes. Thank you so much.
All right. Thank you.